Hi friends, welcome back to Smile Nursing Tutorial. How are you all of you? Okay, let's come to the topic. Today we are going to know about the care during labor and delivery intrapartum care. In this we will see the key messages of the mother and the newborn. Coming to the mother, we have to encourage her to desire and feels comfortable during labor. So, in this stage, you have to maintain a photograph which will help you recognize the need for action at the appropriate time to ensure timely referral. Not only that, to ensure active management of the third stage of labor, thereby preventing postpartum hemorrhage. Next, coming to the newborn, we have to maintain airway and breathing, maintain body temperature and prevent hypothermia is very important. Not only that, we have to ensure the breastfeeding within the first hour of the birth. We have to recognize the danger signs of the newborn and make timely appropriate referrals. Coming to the introduction. What is normal labor? You already know, but just we will let you know one by one. Normal labor is a spontaneous process of expulsion of the fetus and placenta. So, coming to the assessment. In this assessment, we have to ask the mother, when did the contractions begin? How frequent are the contractions? How strong are they? Has there been any watery discharge? Has there been any bleeding? Is the baby moving? Are there any other complaints? So like that we have to assess the mother, and also we have to check the record for history of the present pregnancy. For example, hemoglobin status, TT immunization, RH status, any complications and any other significant history. So we have to assess the when was the LMP, and also we have to determine the EDD. We have to ask the history of any past pregnancy. We have to conduct general physical examination like record the temperature, pulse, blood pressure, weight and check for pallor, edema and so on. Next, coming to the abdominal examination, that also we have to assess the fetal lie and presentation, FHR and frequency and duration of the contractions. Coming to the supportive care, it is also very important in this topic. Okay, first of all, we have to give the privacy of the women during examination and discussion, and also we have to explain all examinations and procedures to be carried out on the woman, and also we have to encourage the woman to empty her bladder frequently, and we have to remind her to pass urine every 2 hours or so, and also we have to tell about the presence of a second person is a beneficial, that is also called as a birth companion of the women choice. Next, coming to the vaginal examination, we have to see the pelvic adequacy, progress of labor and stages of labor. And also we have to remember while doing the vaginal examination. So vaginal examinations are very rarely required during pregnancy. During labor, vaginal examination should not be attempted more than once every 4 hours. Why? Because we have to avoid unnecessary infection to the mother. And also don't carry out a vaginal examination if the woman is bleeding at the time of labor or at any time during pregnancy. Very important thing is don't start a vaginal examination during a contractions. Okay, remember this. Just simply we will discuss about the steps for doing for vaginal examination. Before doing the examination, first we have to clean the vagina, vulva and perineal area with a mild antiseptic solution. After cleaning, we have to separate the labia with the thumb and forefinger of the left hand and clean the area once again. Use two fingers of the right hand, that is index and middle fingers, and insert them gently into the vaginal orifice without hurting the woman. Next, coming to the pelvic adequacy. Pelvic assessment is very important in case of both, whether it is a primigravida or multigravida, who have a past history of prolonged labor or difficult labor, and those who could be associated with the cephalopelvic disproportion, that is CPD. Next, coming to the normal pelvis, the sacral promontory is not reached, the sacrum is well curved, the ischial spines are not prominent, and both ischial spines cannot be felt by the finger inserted at the same time. Okay? Are you understood? Good. Next, coming to the progress of labor, cervical effacement and cervical dilatation in centimeters. In this cervical effacement, this is progressive shortening and thinning of the cervix during labor. Okay. Next, in cervical dilatation, this is an increase in the diameter of the cervical opening in centimeters. A fully dilated cervix has an opening of 10 centimeter. At this stage, the cervix is no longer felt on vaginal examination. Normal effacement and dilatation will facilitate expulsion of the fetus in the second stage of labor. Okay, you already very well know about this. Next, everybody knows about the false labor pains and true labor pains differences, but now you can see the in Smile Nursing tutorial already we have uploaded. Okay, now I am not going to discuss about that. After that we have to see the stages of labor, that is first stage, second stage, third stage and fourth stage. So these steps also already we have discussed in our Smile Nursing tutorial. If you want, you can see the stages of labor. Okay. Next, coming to the monitoring and managing the stages of labor. First, we have to know how to manage the first stage of labor. Next, coming to the monitoring, first we have to see the every 1 hour contractions, frequency, how many contractions in 10 minutes, and duration for how many seconds each contraction lasts. Next, we have to see the fetal heart rate. Normal FHR is between 120 and 160 beats per minute. You already very well know about the FHS. Okay. And also we have to monitor the presence of any signs of an emergency like difficulty in breathing or shock, vaginal bleeding, convulsions or unconsciousness. Not only that, we have to monitor the following every 4 hours, that is cervical dilatation in centimeters, temperature, pulse and blood pressure. Coming to the management, we have to record the time of rupture of membranes and color of amniotic fluid. And also we have to monitor the every 30 minutes like maternal pulse, contractions, frequency and duration, fetal heart rate and presence of signs such as meconium, blood stained, amniotic fluid and collapsed cord. And also monitoring the cervical dilatation every 4th hourly, temperature and blood pressure also. Okay. Next, we have to start the partograph when the woman reaches active labor, and also we have to reassess the woman and consider criteria for referral. Next, What is partograph? The partograph is a graphic recording of the progress of labor and the condition of mother and the fetus. Already we have discussed about the partograph. For that reason, now I am not going to teach this. If you want to see, you can see in our Smile Nursing tutorial. Already it is recorded. So now we have discussed about the first stage of labor, that is monitoring and managing the stages of labor. In this we have also seen the partograph. Next we will see the second stage of labor. Okay. The second stage of labor begins when the cervix is fully dilated and ends with the expulsion of the fetus. Okay. Next, what are the signs of imminent delivery? Vulval gaping, thinned out and bulging perineum, anal pouting, visibility of the baby's head at the vulva. So this is very important when you want to do the imminent delivery. When the cervix is fully dilated during a contractions, we have to encourage the woman to take deep breath and push down. First, the head is delivered, and second, the shoulders and rest of the body is delivered. Okay. After delivering of the baby, we have to see whether the baby is crying or not, or meconium is present or not. So you people know very well about the resuscitation techniques, observation, care and all. Okay. Next, after delivering of the baby, care of the cord is very important. We have to wait for 2 to 3 minutes. After that, we have to keep knots between 2 to 3 centimeters one knot and 5 centimeters one knot. Next, taking with sterile blade or scissor, you have to cut between the knots. Otherwise, if you have any clamp, you can clamp the cord when cord pulsation stops. Okay. Next, coming to the third stage of labor, active management of third stage of labor. Already you people know very well about that. Just I will tell very briefly. If you want to see, now you can see in our Smile Nursing tutorial. Already it is uploaded. Okay. In this AMTSL, first we have to see the uterotronic drug. That is, injection oxytocin is the drug of choice for all health facilities, whereas tablet misoprostal is to be used when adequate refrigeration of injection oxytocin is not possible. Okay. Understood?